Yeah. Hello, everyone. My name is Moteka, and I'm here with Philip. So our topic is bipolar disorder, otherwise known as manic depression. Yeah, as the name goes, bipolar, bi means two, and polar, we know that, for example, we can equate this to the two sides of a coin that has two sides. So bipolar means, as with regards to our topic, it's a kind of mental illness that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. Bipolar disorder have periods of, we can say, depression. When we talk about depression, we're talking about somebody feeling very low in energy and suicidal thoughts. Then the mania is the feeling in which case the person has very high energy, and when there is less severe mania, it is known as hypomania. Unlike simple mood swings, each extreme episode of bipolar disorder can last for several weeks or even longer, and some people may not experience a normal mood very often. Unless you have severe mania, bipolar disorder can be difficult to diagnose. Then here we would like to talk about the causes. We have to understand that there are several factors that contribute to this illness or make somebody susceptible to this particular illness. One of the causes could be the brain structure or the functioning. In this situation, brains of people with bipolar disorder may differ from the brains of a healthy person or people with other mental disorders. Then another aspect that can put people at risk is about the genes. Here, some research suggests that people with certain genes are more likely to develop bipolar disorder than others. But genes are not only the risk factor for bipolar disorder. Another cause could be family history. We have to understand that in families where the parents are bipolar, it is obvious that the siblings could equally have this bipolar disorder. Then we'd like to talk some of the symptoms of a bipolar disorder. When talking about mania signs in bipolar disorder, like we mentioned in the previous slides, mania is a situation where the individual has elevated moods and the person has a lot of energy. So some of the symptoms when we're talking about mania could be somebody feeling extremely happy, high for long periods of time. Grandiose beliefs. Grandiose is a French word which means that somebody has a kind of high thoughts or high expectations in whatever he or she is trying to do. Then another symptom is having a decreased need for sleep, and then the person speaks so fast, and the person equally feels extremely restless or impulsive, as well as increased irritability. And then another symptom is that the person engages in a risky behavior such as gambling, in which case the person could say gamble with all of his wealth. Yeah. Some other symptoms, now we talk about the opposite side of it, which is depression. The signs for depression in bipolar disorder is that the person always experiences some sadness or some sort of the person feels so empty in life, the person feels so hopeless, as well as being guilty of whatever he or she does. The person lacks interest in activities that he or she was so much interested. Overall, we can say the person has low energy, and there is trouble also with the memory, like the person doesn't think properly. Yeah. Then here we would like to talk about planning. I would like to hand over this aspect of our presentation to Philip.
Thank you, Moteka, for presenting the earlier points. I'll take it from the planning. But first of all, if you want to plan, we need to consider a few things. And when planning care for any medical treatment, you first of all need to consider the person as an individual. And secondly, in bipolar disorder, the planning is usually done to consider a particular phase of the disease. Now, the phases include the acute phase, continuation phase, the maintenance phase. Now, with the acute phase, it's kind of medically stabilizing the patient's condition. And then when you look at the continuation phase, it focuses on motivating the patient to continue taking their prescribed medication as planned. And lastly is the maintenance phase, which is maintaining the situation and then preventing relapse. Now, if we are planning the care, you need to assess the patient, and briefly there's a chart here that indicates how to identify the signs and symptoms and then plan the care for the patient. For example, the nurse's diagnosis for the risk injury, and then it's also the signs which involved is the excessive and consistent motor activity or poor judgment, lack of rest and sleep, poor nutritional intake, etc. So basically this table shows how to assess the patient. Now, the implementation of bipolar disorder. First of all, you rule out the other medical condition and disorders. You conduct a physical examination. You do a blood test and a urine test. Then you proceed to ask about the moods and behavior for a psychological evaluation. From there, you can, if a medical cause is not found, refer to a mental health care provider such as a psychiatrist for possible medication to treat the condition. In that situation too, you can also be referred to a psychologist to help cope with the symptoms of the disorder. Keeping the diary that records daily mood, symptoms, treatment, sleep pattern, and life events are kind of means of implementing this. The best way to manage the bipolar disorder and its symptoms is long-term treatment. Normally, it takes time, so you have to periodically check and manage the situation. Doctors usually also prescribe a mixture of medication to stabilize mood, psychotherapy, and at-home therapies. When medication doesn't work, you then consider electroconvulsive therapy, ECT. Electrical currents are passed through the brain to help relieve depression. That's the first means if the medication doesn't work. And the second one is a transcranial magnetic stimulation, TMS, which then regulates the mood for people who aren't responding to antidepressants. Psychotherapy. Cognitive behavior therapy. Now, it helps identify triggers of bipolar disorder, replace negative thoughts and behavior with positive ones, learning how to cope and better manage stress. Psychoeducation. To learn more about bipolar disorder to help make better decisions about care and treatment. Interpersonal social rhythms and therapy. To help create consistent daily routine for sleep, diet, and exercise. Talk therapy to express feelings and discussion of issues. Now, we then consider the evaluation of bipolar disorder. The patient is evaluated and the care will be continued according to that. Evaluation is done by measuring the patient's progress using nursing diagnosis. In the evaluation and continuing the treatment, you need to consider all the aspects of the patient's life and their own feelings. Now we give some few English Finnish word list. Unusual, epäväline, mood, mieliala, restless, levoton, low energy, matala, energia taso, activity level, toiminnan taso, depression, masennus or hopelessness, toivottomuus. Now we have this list of references that we got those information earlier on, and thank you for listening.